Now, this was a research study published in Gastroenterology, the top GI journal, and they looked at prebiotics compared to a low Fodmap diet and what that does to the gut microbiome and what it does to patients who have IBS symptoms. What they found were patients who were eating a high fiber diet or prebiotics had beneficial microbiome changes, and they had improvement in their GI symptoms. Now, patients who were on the low FODMAP diet, unfortunately, they had also had microbiome changes, but the microbiome changes that they had were harmful changes. They actually had increases in some of the harmful gut bacteria. However, they did have improvement in their GI symptoms. So the way I think about a low FODMAP diet is you might have short-term gain. You might feel better in the short term, but in the long term, you're going to have long-term pain because you are negatively impacting your gut microbiome. So it's short-term gain, but long-term pain. And so if we can avoid doing a low FODMAP diet, I do recommend avoiding it. This was a research study looking at the gut microbiome, looking at symptoms in patients with IBS who did a low FODMAP diet compared to the traditional IBS diet. So the traditional IBS diet is where you essentially try to keep a log and a food diary and figure out yourselves which foods are triggers for you. And what they found was there was really no difference. So when patients tried to do it on their own and figure out what were their own food triggers, that was resulting in the same end result in terms of symptoms as patients who followed a really strict low FODMAP diet. Okay, this was a research study looking at a low FODMAP diet compared to yoga. It was a randomized controlled study, so people were either put into a yoga group or the low FODMAP group, and they found that at both 3 months and 6 months, there was no statistically significant difference between the yoga group or the low FODMAP group. So, like I said, I think that the low FODMAP diet can be very challenging and restrictive. So instead of doing that, I would suggest to many of my patients incorporating yoga into their lifestyle, which can help to reduce the stress and the anxiety, which can help to improve their gut microbes. And they will have the same result in their IBS symptoms as those who followed a strict low FODMAP diet. One of the key things that impacts our gut microbiome is stress. We've talked a lot about some of the others, the diet, the antibiotics, but stress is plays a huge impact. With COVID, we have seen such a significant rise in patients experiencing IBS symptoms because COVID has caused such severe stress on all of us. And what we have seen with that is that there is decreased diversity and richness of the gut microbiome. There are more pathogens, and there's more gut bacterial dysbiosis, resulting in an abnormal immune response, lowered epithelial integrity, lowered mucosal immunity, and we are seeing more GI diseases and more of other diseases as well. Our GI guidelines suggest that psychological therapies like cognitive behavioral therapy, relaxation therapy, hypnotherapy, all of those have been shown to improve IBS symptoms. Is all stress bad? Well, no, all stress is not bad. I studied biological anthropology when I was a college student at Harvard, and we know that stress came around for specific reasons. Stress is really important in stimulating our immune system, in helping us with that flight or fight response. The problem is that many and most of us are now living in a time where we are under chronic, severe, daily, debilitating stress. We are not just experiencing short terms of bouts of stress that are helpful. We are experiencing the burden of stress. We are experiencing high levels of stress daily, and it is impacting and destroying our gut microbiome and impacting our quality of life. one thing I'll say about stress is I'll have patients who have IBS, and they try to figure out what foods are triggering their symptoms. And they'll tell me, I went out and I'm keeping a food log, and I went to this restaurant and I had spinach with cucumbers and tomatoes. And that day I noticed a flare in my symptoms. And so I think it's the tomatoes that are just causing the issue. I'm going to eliminate tomatoes. Okay, I'm not sure that's the right way to go about it, because if you have tried this before, those same patients have eaten tomatoes on a different day and not had any issue. It's not always the food that is causing the symptoms and triggering the symptoms. It's also the stress, the environment, what's going on around you. If you are eating on the go, if you are eating quickly because you have a stressful meeting, if there are other things in your life that are happening around you, your gut will pick that up. And it doesn't really matter what you're eating, your GI system will react. So I want you to be cautious and careful when you think about that, because it's not always the food. The stress and your environment also will play a role. And so in those situations, it's definitely worth trying that food item again, because otherwise you'll end up on a very restrictive diet, which is not going to be healthy. Cognitive behavioral therapy has been shown to be really helpful for patients with IBS. This is a form of psychological treatment that is effective for depression and anxiety. It usually involves changing thinking and behavioral patterns. It uses problem-solving skills to cope with difficult situations. It helps people to face any fears they have instead of avoiding them. And it helps patients to learn calm, relaxed, and gives them breathing techniques. There have been 9 peer-reviewed trials comparing cognitive behavioral therapy to control patients, and they found a 64% improvement in patients with cognitive behavioral therapy. So I do recommend cognitive behavioral therapy for many patients, and I usually refer to a therapist for their assistance and guidance. This was a research study looking at CBT. And actually, I think this is very pertinent when we had COVID and a lot of things went virtual, because what they did was they did a 3-arm randomized control trial, meaning they took patients and they put them in 3 categories. 1, telephone delivered cognitive behavioral therapy. 1, web-based cognitive behavioral therapy. And lastly, treatment as usual. And they found that patients and participants were adults with refractory IBS, meaning they had symptoms for over 12 months despite all the treatments. And they had a telephone and web delivered cognitive behavioral therapy. And those patients had statistically significant improvement in their IBS symptoms. Those symptoms and relief in their symptoms lasted for over a year. So when patients have cognitive behavioral therapy, they get really long-lasting improvement. What about yoga and IBS? This was a 12-week randomized controlled trial comparing yoga and conventional therapy to a control group. And they found significant improvement in abdominal pain and quality of life in the yoga group. And based on this, yoga can be used as a standalone treatment or in combination with conventional IBS treatment. What about exercise? Well, this was a study done. It was a prospective randomized controlled trial. Again, I mentioned these, the study trials, because these trials are both the yoga, cognitive behavioral therapy, and exercise. These are some of the best trials we have to look at these things. So this was a study where they looked at control group, meaning they did their routine IBS care, versus patients who exercise. And they found increased physical activity improved GI symptoms in patients with IBS. Based on this, exercise should be used as a primary treatment modality in IBS. Now, why does this work? There are some suggested mechanisms. We're still learning and understanding more, but we think that exercise counters the effects of stress by reducing neuroendocrine response and visceral perception. Physical activity improves brain plasticity, neurogenerative, and neuroprotective process. It improves intestinal gut clearance and transit time. So this is really helpful for my patients with constipation or bloating. Exercise is very helpful for that. And also, we talked about short chain fatty acids before when we talked about a whole food plant-based diet and how important short chain fatty acids are for keeping our mucosal lining and our gut barrier. And exercise increases short chain fatty acids. This was another study looking very specifically at exercise and the gut microbiome, and they showed that exercise increases short chain fatty acids, which have been proven to reduce inflammation and improve the gut microbiome. They found clear clustering of the gut microbial populations in athletes compared to controls. So what they did actually is they took, this is the controls in the red and the green. They stratified it based on their BMI, their body mass index. And then they looked at these elite athletes. And the bottom line is that those patients and those people who exercise more, those athletes, they clearly have a different gut microbiome makeup, and you can see that. Depression and stress impact the immune, endocrine, and autoimmune nervous system. This can lead to gut dysbiosis. This can cause low diversity in our gut microbiome, which can lead to leaky gut. And behavioral changes, diet, sedentary lifestyle, lack of sleep, and alcohol use, smoking, all of these things can affect both our mind, our mood, and our GI tract. So 6 practical tips to help with IBS. 1, mindful plant-based eating. As much as you can, try to eat a diverse amount of fruits, vegetables, whole grains. You know, one thing that me and my family do is we like to make a game out of it, especially if you have kids or grandkids. We like to try and keep a list of all the different foods that we eat in the day and see who eats the most in a day or a week and just make a fun game out of it. Or if you're going to the grocery store, don't be hesitant to try something new. Try something new, get some diversity, be adventurous with your food choices. 2, minimize processed foods, dairy, and meat. Processed foods, especially processed meats, red meat, deli meats, they're actually considered carcinogens, cancer causing. So as much as you can, minimize, eliminate those things. Dairy really flares IBS symptoms for a few reasons, but a lot of patients will develop lactose intolerance, and that dairy just triggers these symptoms, especially patients of mine who have bloating. They will notice a significant improvement if they cut out dairy. So if you can't do anything or you feel like this is just too overwhelming, the first thing I usually recommend is to eliminate dairy and see how you feel. And I can't tell you the number of patients I've had who have made that change. And once you make that change and you feel better, your GI tract feels better, your mood feels better, you're able to go on with your daily activities of life and you just have more energy, like that's enough of a change for you to then go forward with other changes. 3, it's important to remember that this is about maintenance. This is not a quick fix. There is no quick fix for irritable bowel syndrome. There's no quick fix for your gut microbiome. These are all long-term lifestyle changes. So don't get frustrated and just do the best that you can. Be kind and gentle to yourself during this process. 4, meditation and yoga. I've shown you the research today that shows that cognitive behavioral therapy, meditation, yoga, all of these things that calm our mind and our body also influence our GI tract, and they can calm our GI tract down and help with IBS. 5, moderate regular exercise. We know that exercise increases short chain fatty acids like butyrate and acetate. And by improving those short chain fatty acids, we are setting ourselves up to get a healthy GI tract and gut microbiome, which again will improve our IBS symptoms. Lastly, number 6, move more. Dance, party, have fun. It is so important that we remember that what we are thinking, our mood will impact our GI tract. So have fun, laugh, spend time with friends. For example, when we, in my house, when we have dinner, we really make sure that dinner is a family affair and everybody is there and talking and hanging out, because that social interaction is really important in helping boost our own mood and then boost our GI tract. So you might have heard the expression, you are what you eat. And while that is true, I also want to remind you that you are not just what you eat, but you are what your gut microbiome eats. So it's important to feed your gut microbiome, and also you are who you eat with. Research has shown, and we didn't have a time to go into it, but research has shown that your friends and your friends' friends, you all have similar gut microbiome makeups. Our gut microbiome changes and alters to be like our family and friends. So the people you surround yourself with have a huge impact in how you feel and how your gut microbes feel. Gut instinct or gut bacterial instinct. So the GI tract says to the brain, I don't like it, brain. I just don't like it one bit. The brain says, I trust you, gut. Just tell me why so I can try to fix it. The gut thinks and then can't figure anything out. So it just says, not one bit. The brain walks away. Okay, then. And I bring this up because we are learning so much about the gut microbiome at such a rapid rate. We don't have all the answers yet. We might not know why things are happening the way they are. We don't know for sure which gut microbes are involved in GI illnesses and mood, but we are learning about it. So at this time, sometimes you do just have to trust your gut. So I hope you remember that. And that's it. Thank you. I hope this was helpful. You can reach me on my website, sign up, and I will be getting a newsletter out soon. I'll be giving tips to help with bloating and gas. So lots of things coming up in the future. So go to the website, sign up for the newsletter, and definitely follow me on Instagram and Facebook at Doc Sarina. Thank you.